providing resources and comfort to caregivers. This is Caregiver Crossing.
Well, hi, everybody.
Hi.
Hey, Terry.
Hey.
Hi, Tina.
Noah.
Hello.
Hi, all. Welcome to Caregiver Crossing. We are glad you're here. Caregiver Crossing is a show brought to you by Joyce House in partnership with Cardon and Associates, and we're here every week to talk about all things caregiving. This week, actually, before we get into topic, any updates in your lives that we need to know about?
Let's see. Well, it's fall.
Yeah.
And it's leaf peeping time.
Oh, is that what we call it?
We call it leaf peeping now.
In the profesh?
Isn't that what we call? Isn't that what it's called now? I mean, I always called it just going to Brown County and looking.
Oh, you mean
checking out the leaves? But it's called leaf peeping now.
No, like that's
Is that
the,
real?
The adjective? No, is that
It's
an
actually
adjective?
called
Like
Leaf peeping.
leaf peeping.
You're
me
peeping
not
at
to
the
know
leaves.
that.
Using your peepers.
To see the leaves.
So
as
have you
they
been
turn.
Have you been leaf peeping?
I will
lately?
be leaf peeping.
Where are you gonna go?
Brown County.
Yeah.
Yeah.
Beautiful.
Hobnob is closing.
Oh, that's a sad moment.
November 1st of November. No, Hobnob. All of us that go leaf peeping in Brown County, you know what the Hobnob.
Like
about
forever?
50 years it's been around there.
They're closing
Yeah,
for good.
closing the doors.
Oh,
Yeah. So for all of us with memories of the Hobnob,
that's very
when you're
sad.
leaf peeping.
Okay, all right.
Yeah.
Noah, you?
I recently got to have my first performance for the Indianapolis Men's Chorus.
That's right. Oh my gosh.
You know, it actually really, the performance really means a lot to me here at Caregiver Crossing too, because we got to sing the national anthem for a fundraising walk for AIDS downtown.
Wonderful.
And I was like, really just fits Caregiver Crossing, and I'd love to share that on the air.
I love that.
Yeah, me too.
That was your first one,
Yeah,
right?
it was my first one.
How
And
it feels good?
It was perfect. It was great. It was wonderful, and I'm so excited for the next one. I'll give a little sneak peek. We're actually singing for the Damien Center. We're singing for their fundraiser
Fantastic.
in
Yes.
October.
They've got a new place on Washington Street in downtown Indianapolis.
We're doing a little mashup of The Wiz and Wicked.
Oh, really?
So
how timely.
yeah, very cool. I'm very
That's
excited.
really cool.
That's what's new with me.
Wow, mine's
What
not
about
as
you?
Well, it's not as exciting as that. I am getting ready with a group to go forest bathing.
And a girl.
Are you
This
going
would
to do
be
leaf
your-
peeping? Leaf peeping
Well,
while
we're-
you're forest
I mean,
bathing?
I suppose we will be using our eyeballs and looking at leaves, but no, it's just really about being present and taking in the little things that we often overlook. For me, it's really like the things that God has created for me to witness. And so it might be movement in the forest. It might be the noise that we hear, but it's about being very, very present.
Do you do that here locally?
We are, yeah.
Is there a particular place that
I've
you
done
go
it.
to?
I've done it a couple of times at Holiday Park, which was great.
Oh, that's a
this
good
one
one.
is at
Any of our parks would be a beautiful
Yeah.
spot, whether that is
Marat, maybe
I don't know, but
I do love that
any of
park.
them.
Murat is
in Broderville.
very beautiful.
Mhm.
Yeah.
Yeah, so we could-
beautiful.
I would like to hear when I close my eyes. I'd like to hear Noah doing a mashup of The Wiz and
In the Emerald City.
see, that's what I want. Yeah, I can't wait. All right,
I mean, it was beautiful and everything. I just thought that was interesting that that's what you'd like to hear.
That's the only
I
thing-
want to hear
yeah.
Noah singing to me.
That's
That's
too
all I
sweet.
want.
Too sweet.
All right, I am proud of our Indianapolis Colts for a lot of reasons.
Woo!
All right, a lot of them. I could start naming numbers of the people that I'm proud
Oh,
of,
yeah.
but really proud of them. What I am most proud of right now is that they are tackling mental health in a big way with this campaign that they've got going on called Kicking the Stigma. Familiar?
Started by the dad. Started by Jim Irsay.
Really cool, right?
Mhm.
It was
Yep.
started, I think it was launched by Jim Irsay and his daughters, especially maybe Kaylin Jackson, and just after seeing how mental illness touched their family. And so, Noah, what can you tell us about Kicking the Stigma?
Well, actually, I can tell you that since its launch, since Kicking the Stigma launched, the campaign has raised millions and millions of dollars to fund local counseling, education programs, and awareness efforts across Indiana. And I think this campaign is so cool because they actually use PSAs from the high-profile players and celebrities in Indianapolis to normalize some of these conversations that are about depression and anxiety.
Yeah, I mean, in Indiana, 1 in 5 people report symptoms of anxiety or depression. And for family caregivers, the risk is nearly double. Just take that in for a second. In Indiana, 1 in 5 people report symptoms of anxiety or depression, and family caregivers, the risk is nearly double. I'm not surprised, but it still makes me sick.
Yeah, it makes me sad.
Terry, you have a thought
It
bubble?
doesn't surprise me.
Yeah.
in this moment in time of our lives. It doesn't.
But we
But
never
I did
talk
not
about
ever
it in
think
that way.
about, but I will say this, I did not think about the other end of it, the caregivers that are caring for those that, are you saying they're at risk? What are you saying?
No,
Say it again. So you're saying,
that's okay. In Indiana, 1 in 5 people in general report symptoms of anxiety or depression.
okay,
Now, for family caregivers, though, if I'm a family caregiver, my
Okay.
risk is double
is
that.
double that.
Now, I can tell you from my own experience, I have a history of anxiety. So when I was in 4th grade, I was hospitalized at Riley Hospital for what they called at that time, quote unquote, school phobia. I was not afraid of school, but I've had just a genetic anxiety
And you know what?
disorder my
That's
entire life.
interesting because you're not that old. And so, but not that too very long ago, they called it school phobia.
Well, yeah, think about how much anxiety is now discussed. It was not discussed when we were children.
And so, how did they handle it when it was said that you are diagnosed with school phobia?
So I will
Back
try
then.
and make this very fast. They put me in the hospital. My mother could only see me one time, like every 2 weeks, I think it was. And I met with, I remember his name, I think it was Dr. Green. I remember his office had a bunch of bookshelves in it, but I was literally inpatient for what they thought was school phobia, is what they called it.
Wow, that's just interesting.
It is
where we
it's
are
fascinating.
today.
Now there was therapy too. There was talk therapy involved, and then as I got older, somehow it transferred to panic disorder, and then it became anxiety, generalized anxiety disorder. Not just in me as a human, but just what they called it throughout my lifetime. And now it's such a common
Wow.
thing. But to hear 1 in 5, I mean, that's very scary. And we know that statistically in central Indiana, 40%, almost 40% of people who responded to the Pullis Center when they did the state of aging in central Indiana, almost 40% of caregivers responding said that they had thought about suicide in the last 30 days. And so, the whole kicking the stigma that is brought on by the Colts, it's just a fabulous campaign that they're doing, and it gives us a reason to talk about it.
Yeah, that's
right?
why it's so
Yeah.
important that these high-profile people are talking about it, so that it makes the conversation easier for us, just everybody in the public.
Well, I think, when we don't talk about it, it makes it worse. I mean, just like anything, starting the conversation is the first step to finding relief. So
Right.
I'm proud of us for talking about it. We want you to talk about it too. To each other. You can always email me at tina@joycehouse.org. We'll connect you with any folks that we can. But if pro athletes can speak openly about mental health, then we should all
We should
feel
all be speaking about
that
it.
we can do that too, right? So we've got to talk about caregiving more and more when it comes to mental health. It's just, there's such a tie there. And if the caregiver is falling apart in all of the ways, how in the world are we supposed to take care of the people around us? So I don't know. I guess we have to take a break.
Go Colts.
I don't want to take a break.
We'll be
gotta
right
take
back.
a
We'll be
break.
right back.
All
Tina,
right,
don't
all right.
worry. You can find past episodes of the show at joycehouse.org and be sure to like and follow us on Facebook. You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We're here every week to bring you support, education, and hopefully a good laugh. Visit joycehouse.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much, much more. Don't go anywhere. We'll be right back with more Caregiver Crossing.
We're back on Caregiver Crossing. I am your host, Tina McIntosh, and my co-host,
Terry Stacy.
our producer.
Noah Taylor.
And we have a guest today, a special guest. Bruce Muller is the State Health Insurance Assistance Program, better known as SHIP. I think SHIP is the way we all know who you are and what you do. But every year, thousands of Hoosiers turn to SHIP for free, unbiased guidance on Medicare. Bruce makes Medicare interesting. He has walked alongside families through
That's
open
really saying
enrollment.
something, I have to tell you, because we've been talking this for year after year since Caregivers started, and Bruce does make it interesting.
Well,
Yeah.
hopefully.
You have to answer a lot of tough questions and help people understand, because we just don't really get what coverage, is. So let's start with this, Bruce. First of all, hi. Glad you're here.
Glad to be here.
And for people who might not be familiar, what is SHIP? What do you do?
Okay, again, it is the State Health Insurance Assistance Program. We were an act of Congress in 1995, so we are federally funded. And I checked my phone. I'm still here.
Excellent.
Good.
And we are under the umbrella of the Indiana Department of Insurance. We operate with about 250 volunteers around the state, and then other state agencies that are connected to the aging population also have navigators.
Okay.
So we're here to help people sign up for Medicare. How do I take it? What should I do? I have a problem. I've lost a portion of it. How do I get back on it? There's literally no question that we can't get answered with the staff that we have. So when you get that Medicare and You book at the end of the year, that's great reading. Keep it by your bedside in case you can't sleep at night. And if you do have any questions, that is our local telephone number on the back of that book.
Okay.
Use it as a coaster, right?
Yeah.
And it's just right there on your
right,
bedside.
right,
Perfect.
right.
That's
But it's
perfect.
great. It's great. It really is great reading.
Well, I mean, truly, this is why we're all so stupid about it, because none of us really want to read it because it can be very complicated. Are we in some sort of an open enrollment?
We are approaching,
time?
which if you might be able to tell by all the ads on TV, which
Right.
please ignore them. Don't answer them. Those are
Oh.
not local people representing.
Wait a minute.
That's
You're
a
saying
good point.
the ads that we're hearing on TV for open enrollment,
From the insurance companies.
Yeah.
don't call them.
Yeah. If you have it, a lot of people have a local insurance agent. Use your local insurance agent because they're going to take better care of you.
Man, oh my.
Somebody on the telephone, all they want to do is to get you to buy their policies or change to them. They're going to promise you all these things, and they basically don't care. All they want to do is to, get you as a customer.
I didn't even know that was insurance companies doing that. I really
I didn't either.
I
Yeah.
mean, they're there. They're constant on certain channels.
Yes.
But I
Yep.
never, people are calling those numbers. So
Yep.
this is such a good lesson. Do not call.
Right.
Call ship
Yeah.
instead,
Call,
right?
call us, or if you have a
You're the
local
real
agent,
deal.
deal with your local or any local agent. Just don't do it long distance.
Okay, so here's a question. What is Medicare?
Okay, Medicare is
Oh,
basically
that's a good one.
that's our kind of our national health insurance for people over 65 or people who are under 65 and perhaps on disability.
Okay.
So you do have to be 65 again, unless you're on disability.
And I think we all think that once you get to 65, then you just sign a piece of paper and now you're on Medicare.
Well,
right. There's a box and it just says Medicare. Check and I sign
And
it.
that's
Yeah.
it. But
Is that
there's
it?
a li- is it
Well, no,
little
it's
more
all a little
complex?
bit more than that. And
Oh.
that's what we're here for, is to explain the differences, because it's very important. Now, you are making a pretty important decision as to how you're going to take your health care needs for the rest of your life. And so there's some
Womp, womp, womp.
yeah.
It is womp,
and
womp,
hopefully that's a long
Yeah.
hopefully that's a long time. But so if you're going to work past 65 and you have what we call credible health insurance through your employer, you don't need to sign up for Medicare yet. So you can work until you're 90, and as long as you have that, and that your spouse could also be on that plan, you don't have to sign up for Medicare.
Okay,
at that
so
point.
really it's for us as we get to a certain age, which is 65,
Mhm.
because whenever it came in to be in the 1990s, we assumed that by the age of 65, most of us wouldn't be working any longer,
Right.
but we would continue to need health insurance.
Right.
Well, listen, I've only been in this business for a quarter of a century, and I think I've just caught on,
Yeah.
Oh, I'm yay.
right?
Yeah. I mean, I'm really
It's-
glad.
Well, it's totally
But-
confusing. And the one thing you don't want to do, if you're turning 65, you're going to get a hold of somebody, get a hold of SHIP and go through and you become educated. But before you come to us, please don't ask your sister, your mother, and all your friends how they take their Medicare, because they're all going to have a different answer, and everybody's situation is different. Your health situation might be different. Your wants and needs might be different. It's kind of like going to a financial planner. You might want to keep all your money under the mattress, whereas I want to invest in the stock market. So it's kind of a personal decision as to how you want to do it. And people who have had employee plans for years, they're kind of spoiled because they just look and go, oh, let's see, what are my policies for this year? Oh, A, B, okay, I'll take this one. But when you go on Medicare, you really need to study and do your homework so you know exactly what you want to do. And SHIP will explain that all to you, but we will never say, oh, Tina, this is what you should do. No, we're going to educate you how to take it, and then you decide.
So when I call SHIP, when that time comes for me, am I going to get to talk to a human, or is it going to be one of those like, here's a webinar or here's a group
No,
setting that you
no,
can go to?
we're all humans. You don't have to hit.
Praise
I am not a
God.
robot. Um, in fact, with Medicare, if you've been given wrong information from AI, it's going to make it hard to, if not impossible, to change. To say, well, I was given wrong information. If you get wrong information from a human, then that's a whole different story. But again, we're going to explain it and help you do it.
Are you worried that AI is going to take your job?
No, but let's be
Oh,
honest.
nobody can replace me.
AI has
No,
a
sir.
worse AI has a worse memory than most humans.
Very
Yeah.
AI
true.
doesn't
That's
work
good
in a
to
memory
know.
bank.
Well, and
so-
it only knows knows basically what it's been told.
That's right. It's based on the prompts and what it can pull from its online, books. So
And that's
Yeah.
one of the great things about SHIP. We're not like a regular government agency, if you will. People, when they talk to a SHIP counselor, any of us involved in it, people immediately find out that, hey, we're all different. We almost become your friend.
But that's what we need.
Yeah.
That's
Yeah,
what we need.
somebody
It's a
that you
big
trust,
switch.
right.
And so I'm hearing a couple of pitfalls. Don't just AI, don't just
Nope.
chat GPT,
No.
all the things you're looking for. Do not call the numbers that come up on your television.
Right.
Be careful if somebody reaches out to you, email or text or a phone call,
Right,
because we get
right.
those too. What other pitfalls before somebody gets to you are you hoping that they can avoid?
Well, again,
Don't talk to your mom or your sister.
Yeah, right, right.
Yeah. Right.
But basically, you've got to be responsible for yourself, and so because even for each person, for one spouse, they might take their benefits one way, and the other spouse might want to do the other, because it's all based on on an individual. And again, you just want to get the basics down. For a lot of people, that's hard, because it is confusing, because it's not as cut and dry. When you get your house insurance, you basically say, hey, what's your deductible? Does it cover my roof and my plumbing? Oh, okay, good. How much is it? That's not the way it is with Medicare.
And what about this? And we've just got just under a minute here left. I'm wondering if you can change it.
Okay, that's what can go on during the open enrollment period. So you're going to have from October 15th to December 7th. Now's the time you can change your plan. So if you're on original Medicare, that's what we call alphabet soup. You got Part A, B, D, and you want to go to an Advantage plan. Now you can take a look at that plan. And if you're on an Advantage plan and you want to go to a different Advantage plan, now's the time that you can change. If you're on an Advantage plan, you want to go back to original Medicare, yes, you can do that. But now you've probably been on Medicare longer than 6 months from your original time of starting it. But now that supplement company that's going to pay a portion of your Medicare cost, now they can underwrite you, meaning they can look at your health and decide whether or not they want to insure you.
All right, we're going to have to take a break. Here's what I need. When we come back, I'm going to need you to say that stuff like I'm 5 years old, because I swear I just zoned out. This is where I get lost. Just to be honest, my brain does not work in this way. So when we come back, I really do think it's important for people to hear.
I agree.
And I don't know anybody better to explain it. So we'll be back in just a moment with Bruce Muller, can't talk today, from SHIP.
You're listening to Caregiver
That's
Crossing,
ship with a P.
Oh boy.
a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We're here every week to bring you support, education, and hopefully a good laugh. Visit joycehouse.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much, much more. Don't go anywhere. We'll be right back with more Caregiver Crossing right after the break.
Hi, everybody. Welcome back. Hi, I'm Terry. Tina's here, and so is Noah. If you're just joining us, this is Caregiver Crossing. We're here with a few more minutes anyway. Glad you're here, and also glad that Bruce Muller is here. We're talking, Bruce is with SHIP, and we are talking SHIP with a P, and we're talking about it is that open enrollment time for Medicare. And once again, we're trying our best to wrap our brains around it to understand what it is, what we're looking for, what our needs are, and you can't find anybody better to us than Bruce. Bruce, thanks for sticking around through the break.
Great to be here.
So Tina, we had her for a while.
No,
She
it was
was
a great
really following
conversation.
along, and she was following along, and then all of a sudden, before we took a break, she says, I'm going to need you to really break this down.
Yeah, I start to zone out. It gets very
She zoned out.
overwhelming,
And I'm sorry, Bruce.
well, I don't think I'm.
She's
I'm
not alone. She's not alone. We're
I'm not
all,
the
we're
only
all-
person,
no.
right? Like Bruce, this is hard.
Yeah.
And so this alphabet soup, I heard that you prepared a song and a dance to explain
Well,
Medicare,
Well,
A, B, C,
well
and D.
basically, if we run out of time today, tune into our midnight show. We'll be on the air from midnight to 3 to re-explain all this.
It only takes 3 hours. So
funny.
alphabet soup is what we call this in Medicare, the parts A, B, C, and D.
Right.
And what's a really simple way to explain those?
Well, again, that's what we call original Medicare. Part A is your hospital, basically. Part B is your physician and other benefits. And Part D is your drug plan. So when you're on original, you sign up for those, but there is kind of a sub chapter under Part B. We are going to pay 80%, and then you have to pay the other 20%. And that's when you buy a supplement or a Medigap plan, because that will take care of all those extra charges. So that means you will have a policy issued by an insurance company called a Medigap or supplement plan again, and that will cover all of those. And with original Medicare,
All
you
those
can
extras you're talking
mhm.
about.
Yeah, the kind of the gaps that Medicare leaves behind. So you will literally end up with no extra expenses when you go to the hospital or the doctor. And that plan, you can go anywhere in the country as long as they take Medicare, you're covered. So that's what we call, real quickly.
Regardless of where we are in our country,
Mhm.
moving around, those that are mobile and
If you're going to stay in Florida or Arizona for a long time and you need to go to a doctor every 2 weeks, that's the way you can do that without having to worry about who's in the plan. And that's
Tina's raising her hand again. Yes, to the
Well,
lady in the back.
Hi, with the red eye. I got itchy. Allergies, guys, allergies. But Medicare, there is this, I guess, common misconception that Medicare will cover all of your health care needs. Is that true?
well, to a large degree, it's going to cover things, especially with original Medicare. Now, as an Advantage plan operates a little differently. They do have a network of physicians and hospitals or other type of nursing homes and things like that. And they're set up by county. You can travel with it. You're covered for emergencies, but if you do have to see a doctor on a continuous basis, then you would have to make sure that they're in that they're in your network. So that makes it a little bit more complicated. So even for here locally, people have to decide, do I want to really be in control of my own health care through original, or do I want to join a managed care plan where they have a little bit more say in my health care needs? So that's again where you come up with, everybody feels a little differently. How healthy am I? Do I want to be able to go to any doctor, or am I content with the doctors that they tell me I can go to? So there's just lots of ins and outs to it that can kind of confuse one. Again, going back to the open enrollment period, that's the time you can make these changes. You can also
I know when that is. October 15th through December 7th.
very good.
Thank you.
Okay.
Thank you.
Good.
Yeah,
Good.
I've,
See, you
I've
are
do-
learning.
I've done my job. So that's, again, you can sign up for your Part D, your drug plan. You can change your Advantage plans, and you can also join an Advantage plan or go back to original Medicare, but then they do have that stipulation that now they can underwrite you. So I do want to touch on a couple of things on talking about the open enrollment. This year, it's really important that you pay attention to your situation. I tell people this is not the casino. You can't let it ride. You've got to.
Oh, I love that
You're
game.
going to get an annual notice of change from your company. Go through it and make sure all your doctors are still in the plan. Make sure all your drugs are still in the plan, and anything else. Now, because the insurance companies are making lots of changes. I know in some counties they're dropping certain plans, and that's not all cast in stone, but you've got to really check that and make sure everything's in place. But if everything's in place, I'm kind of, if it ain't broke, don't fix it. You can kind of get sucked into other things and maybe not be as happy with the plan that you do join. However, to make it even more confusing, if you're on an Advantage plan, January 1st through March 31st, if you've got the wrong plan or you still don't like your plan, you get one more opportunity to
that's
change
great.
it.
What do you
But
call that time period?
that's an enrollment period for Advantage plans. Kind of. That's
Okay.
during the general enrollment period, but it's also available.
Okay.
But what I recommend to people is be careful. Don't shop around. You can only make one more change.
Right.
And that will be the one. So it's dangerous to put off until that time period.
Oh boy.
So, and
All
you-
right. So how can people get a hold of SHIP? Is there a website they go
well,
to?
you can go to our website, www.medicare.in.gov, or you can call us at 800-452-4800. And our call center will take your call, and maybe it's a question they can answer right there. Sometimes when we'll be real busy, one of our volunteer counselors will be contacted, and they will talk to you. We also have locally, we have a site at Prime Life in Carmel. I have 4 to 5 counselors there. We have a site through IU Hospital in Bloomington. We have 4 to 5 counselors there. And also Heritage Place at 46 in Illinois. And on the south side, Crestwood Village has a site with all of our counselors. So we can do it over the phone. We don't we don't make house calls. But lots of times we can answer it on the phone. And we'll help you if you're especially if you're computer literate. We would like to have you, go to the site and we can walk you through it just so you understand better as to what's happening. Because the main thing is education, education, education. So you're not making a mistake that's going to haunt you for the rest of your life.
Just a very quick question. We just don't have that much time, about 20 seconds here. And I'm curious to know, if you sign up, you're enrolled, how long does it take before it's actually...
Well, if you
got it.
when you change a plan through this open enrollment period, they all start January 1st.
Okay, January 1st. Got it. Thank you, Bruce. You're so good. Bruce Muller, again, he's one of our SHIP guys, and we just love you. Thanks so much for explaining to us once again. I'm sorry that it takes us a long time to understand.
So long.
I'm so
Okay,
sorry.
See you at the midnight show.
You bet. Thank you, sir. All right.
Thank you, Bruce. You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you as a service of Joyce House in partnership with Cardon and Associates. With locations in Broad Ripple and near the University of Indianapolis campus, Joyce House provides exceptional day services for individuals living with a life-altering diagnosis and compassionate support for family caregivers throughout the community. At Joyce House, we believe that everyone deserves to live their best life, regardless of their abilities. Learn more about our adult day and caregiver support services by visiting joycehouse.org today. Stay with us. We'll be right back with more Caregiver Crossing right after the break.
Hi, everybody. Welcome back to the final few minutes of Caregiver Crossing. Terry, Tina, and Louie. I always like to call you all the different names.
I'm sorry.
I
Bob.
know
I
he's
love having
here.
a different name. They'll
And,
never know who I am.
It's Noah. Noah Taylor, who produces the show and does such a great job for us, too. By the way, thank you, Noah.
High
Because
five.
you know,
guys
I
are
don't
so
know that
sweet.
we
Thank
ever
you.
tell how much we appreciate you, but you do such a good job putting the show together each and every week.
Thank you so much.
In the United Kingdom, did you know? In the United Kingdom, dementia is treated as a community issue, not just a private family matter. What does that mean? What does that mean? They have built a reputation for creating dementia-friendly communities, showing what's possible when awareness becomes part of everyday life. Are we not doing that,
I think we're on the way there.
Tina? Tina Bina?
Oh, go ahead. I want to hear more. I think there's more thought bubble in there.
Yeah, I think we're absolutely on the way there, but I think the UK is a little bit further forward maybe in that discussion, and bringing some of those diagnoses to the public forefront. I feel like just in the past years here, we have had celebrities talking about their diagnosis with dementia, and I think that we're on the way. We're we're making the right strides at least.
Please, I do want to know what you think.
Yeah,
Are
I
we?
would agree with what Noah is saying. I think that there are different ways to go about the conversations. I will say in subcultures in all across the world, but thinking about the United States, there are some subcultures who look at Alzheimer's like a curse.
Yeah.
And they don't talk about it.
Absolutely.
And there are a lot of families who they just want to keep it as a very private family matter. And I've known a lot of those families here in Indianapolis that do that. I don't know. Then sometimes you don't get the support. You don't get the stigma, quote unquote, but you also don't get the support. And so I know that the UK does some really incredible things. There are some online caregiver tools that they use within their own communities. They have a Dementia Friends program, and they've trained more than 3 million people across the United Kingdom. And it's everywhere from like the bus drivers to the shop clerks to the bankers and the postal workers. And so
And that, I think,
that's key.
is something we could learn. We could learn so much about that, right? We could do that. Those are things we can do right this minute.
Indiana has started a Dementia Friends Indiana. It is a
Oh, really?
pretty new. I believe it started last year. I want to think that
It's been around for a while, but yeah.
We have to talk to them.
Yeah.
Yeah, we should have them. We've had them on before over time, but
just to find out, training-wise, numbers-wise, are people open to this? Do
Absolutely.
we get these numbers like look what they're doing here?
But part of the thing, I think the issue is if I walk into, Terry, your shop, okay, and even if you're trained.
Is it a bait shop?
It is a bait shop because I've met you, and I desperately want to come and buy some bait to go fishing, okay? So I come in, Noah's my brother. Noah, you take me in. But if Terry doesn't know that I have dementia,
That's right.
even if you've been trained, what good does that do?
It doesn't do any good. But what would they train me to look for? Or what am I looking for? Or
It's usually not
so
what
maybe
you're,
I should be trained.
It's usually not what you're looking for. It's how you respond and how you guide
How you treat
with
people.
somebody, how you treat people. So, I mean, here's my thing. And we're going to make some changes going into 2026, I think, with Caregiver Crossing, where we're going to really use us as a platform to have these conversations kind of in a different way and really empower people in the communities. And so, like, I think it's ideal if a restaurant does a 2-hour block where it's like, come in with your loved one who's living with dementia, or if you yourself is living with dementia,
Movie
like
theaters,
we're gonna
all the things.
all of the things, right?
The
If we
zoo.
but then it's like, so we expect everyone to do it with people living with dementia, but then what about autism, or what about anxiety,
Yeah.
or what about like I don't know. So
No.
we only have
That's
so much
that's
capacity.
thoughtful. I didn't think about that.
But yeah, the UK is great. We actually have somebody coming to visit Joy's house from Ireland. I don't know. He's coming here in a couple of weeks just to learn how we're doing things here. So yeah, I think there are lots of ways for us to write together. There's also doctors can write these social prescriptions. So instead of only sending a patient home with medication, which how many times has that happened to all of us? They're also prescribing participation in choirs, Noah. Indie Men's Choir. Did I say it right?
Yes.
Walking clubs, memory cafes, things like that. Which makes me think about there's this walking club that is meeting in Broad Ripple, and they are walking to music.
Oh, that's
It's
so
like a
cool.
dance walking.
You know, I always
club.
hear about running clubs, but a walking club feels so much more inclusive.
And so everybody's wearing headphones,
Well, there is that. I don't know if this
and they're all
particular one
hearing the
does
same
that.
music, and then you walk to the music.
That is a thing across the nation. I'm not sure if this particular one has the headphones and you're listening to same, or if they've just got like, I don't know, today's version of a boombox. I don't know.
Oh, I see what you're saying.
You know what I'm talking about.
And they're like a parade.
Like a
the
parade.
boombox is leading the parade, and people are walking like the Pied Piper.
Uh-huh. So imagine getting a social prescription for that. Wouldn't that be cool? We could start that.
I think we should.
I think that would be
I
awesome.
like it. Yeah, so there's a lot that goes into these efforts, right? It's, we mentioned bus drivers, librarians, grocery clerks. I don't know if we all just knew how to
Yeah.
respond with that patience and that compassion, but
I
it does
agree.
take a lot of coordination. And then throw in the emergency responders as well. That's a big deal too.
Mhm.
So, yeah, I don't know. That's all I have to say about that.
No, I think it's great. I mean, imagine just getting that diagnosis, and you're still pretty well. You're functioning. You're
Mhm.
functioning day to day, but you've gotten that diagnosis, and thinking about all of the things that now will not be. That now you're not going to be able to do or go to in your future. That's got to be in your brain. And so being able to know that these kind of things are opening up doors for you,
Communities.
Yeah.
communities are opening up for you, maybe maybe it helps a little bit.
Absolutely. I think dementia care really
know?
works best when it's the whole community chipping in and not just somebody's sole caregiver or not
Yeah.
just their family. We should all be supporting each other.
I don't know, I just feel like sometimes we do it to ourselves, though.
Yeah.
We block everybody. I don't need. Thank you. I don't really need the help, and
I don't want it.
no,
Yeah.
it's just best if I do it myself. And then, and I'm speaking from my own experience, and then I wonder why I feel alone. No one
Yeah.
understands what I'm going through. Nobody's showing up for me. Well, the reality is a lot of people asked, and I just said, no, I've got this. So I don't know. It's a tough conversation, but hats off to the UK because they really are doing a great job and come up with some very creative things for these community issues. It's not just a family matter.
It's everybody.
Yeah. All right.
Have we got to go? We got to go.
We got to go.
Yep.
Whatever.
Yeah, we
Before
gotta
we
say
go,
so long.
can I say thank you to Cardon and Associates?
Please.
Thank you, Cardon and Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardon and Associates provides residents with the best senior living options and personalized service. All right, Noah, close us out.
Until next time, take good care of each other.